Ladies and gentlemen, thank you very much for waiting. Now we begin panel discussion, a city where health connects people and communities. First, I'd like to introduce to you the panelists. The first panelist is a professor of Tama University, director of the Research Institute on Medical and Care Solutions, Professor Toshiki Mano. The second panelist is from Fukuoka Prefecture, director of Hisoyama Town Health Check and Care Center, Professor Hiroshi Kiyohara. And the third speaker is Dr. Kazuko Yuma, Information Society Research Department Senior Researcher, Institute for Institutional Socio-Economic Studies. And last but not least, Mr. Takehiko Saito, Director of the Sales and Marketing Division of Aeon Retail Company Limited and Aeon.com Company Limited, the CEO. He is also a project leader of a local ecosystem initiative, and the moderator is Dr. Hiroshi Komiyama, chairman of Mitsubishi Research Institutes and chairman of Matsumoto Area Healthcare Industry Promotion Council. The theme is a city where health connects people and communities. Now I give you microphone, Professor Komiyama. Good afternoon, ladies and gentlemen. So the theme for discussion today is a city where health connects people and communities. We have 2 hours for the panel discussion. Needless to say, health is the basis for individual happiness. And there are so many implications in this regard. We are living in the society of longevity, and there are issues concerning spending, skyrocketing healthcare spending, medical cost. But the basis for so many things is health of individuals. Japan is a country of longest longevity, life expectancy in the world. And that's one of the things we can be proud of. At the beginning of the 20th century, do you know what was the length of the average life expectancy in the world? There are a lot of young people in the audience, so I feel more energized than usual in coordinating this panel discussion. And the elderly people do not change even if they are given advice from others, but the young people are in the process of further growth. At the turn of the 20th century, the average life expectancy in the world was 31 years old. Greece and Rome, thousands of years ago, the average life expectancy was estimated to be only 25 years old in Greek Roman eras, and over thousands of years, only 6 years was extended to the average life expectancy. But today, the world life expectancy on average is 72 years old. So in the 20th century, in the world average, the life expectancy was extended by 40 years. So in the beginning of the 20th century, it was so hard to feed ourselves. The food wasn't sufficient in countries around the world. But today, the word famine is almost unheard of in advanced countries. On the other hand, obesity or diabetes are more of a serious concerns for people in advanced countries. So in the past 1 century, as a result of an industrial revolution, many people live long enough before they die. So it's truly a positive development. We shouldn't turn this positive development into something negative. We enjoy longevity, but in this world of aging, we may lose dynamics or energy. And if that turns out to be true, we have developed civilizations to such an extent where we can enjoy longevity. we shouldn't lose that benefit gain we achieved. But how can we live longer? Not just live longer, but live longer with a good health. And how can we live fully to the end of our life with a sense of dignity as a human being? That's one of the most important issues we need to discuss. And also the other one, COP 23rd meeting in Bonn, climate change convention. That's a global issue, but on an individual basis, our health is the most important topic and priority. And Matsumoto City is one of the pioneering cities in the world which noticed the importance of health ahead of others. It's very cold in Matsumoto City. Despite this rather unfavorable climate condition, Matsumoto City declared itself the world health capital 7 years ago. They issued a declaration. And according to Mayor Sugenoya, this is the lucky seventh World Health Capital Conference. The first one was held 7 years ago. And in concluding the first conference, the conference issued the Matsumoto Declaration as the World Health Capital Conference. And in the second conference, they began Matsumoto Health Lab initiative, which is now a reality, has already begun their activities. But that idea of Matsumoto Health Lab was generated in the second conference. And the national government and local authorities, even if they try to drive exercise and health initiatives, those governments are constrained by budget. So that means new business industries might be necessary to have enough funding for health promotion. So the Matsumoto City began incentive schemes to promote health industries. And also in the third conference, health tourism in Shirahone hot spa area was organized a side event where participants get together to have a health discussion. And in the fourth conference, social capital was the main theme. When we come to think of it, in this World Health Capital Conference, we have invited the speakers from European countries, Sweden, the Netherlands, Denmark, Finland, Switzerland, and Germany. So most of those speakers were invited from European countries. And from Harvard University, Professor Ichiro Kawachi was invited for the first time as a non-European speaker in the fourth conference, stating the fact that where social capital of the human bonds in a community is strong, the people's health is well kept. So that was the topics discussed in the fourth conference, the importance of social capital. And this statement gave us encouragement as we promoted Matsumoto Health Lab project. In the fifth conference, to promote the advanced nature of our Matsumoto Health Lab, we invited the director of WHO Kobe Center as the keynote speaker, and also Robert Dahlin, a Swedish company, was the second keynote speaker. As we aged, we suffer various physical disabilities, and a Swedish speaker noted the importance of supporting such deficiencies with robotics. And to stay health through prevention is, of course, important, and care is important. But to avoid dependence on care, various assistance should be provided. And robotics is a big industry in Japan, and Sweden is a country strong with application.
Japan is good at manufacturing, but in terms of use of what is made, we are lagging behind. And I think that is a big issue. We might have good robots like HAL, and this is a wonderful robot from Japan, but it was used in Germany or Sweden. They were earlier, and I would think that is rather negative for Japan. So people from Sweden, the fact that we could discuss robots with them was a very good opportunity. And the previous year, last year that is, discussions have become ripe. And Freiburg, along with Matsumoto, has smart cities or health cities, and a famous German town was represented, and there were discussions about the Matsumoto Health Valley concept, and we were able to confirm its importance. And with regards to creating a healthy culture, of course, that's not easy to do, but in Nagano Prefecture and Matsumoto City, we have from old times that kind of culture rooted. So the significance was confirmed anew, and so now we are having the 7th conference. And so now the health lab that we had thought about from early on has been realized. It would be meaningless just to have discussions without realization, but it has been realized. It's still on the order of several hundred people participating, but I believe that going forward, the number of participation will go up. In that sense, I said lucky 7th. This is the 7th World Health Capital Conference. And we want to have epoch-making kind of panel today. And so we have these 4 wonderful panelists, each from different fields. And we also have from the Netherlands electronic health record talk that is between the hospitals, records and medical charts and drugs, to link all of this together and utilize data. Well, that's known as EHR, or taking individual information, personal health record, PHR. We had heard about that, and I think Netherlands is far ahead of us. And Japan, too, in terms of regions. As we heard from Japan, there was the example of the southern part of Japan, Kyushu, Usuki City. So that it's not that there is just because you're outside a big city doesn't mean that it is inferior, but I think we don't really have a good grasp of what is taking place all over the country. So what should we do going forward? And in that sense, this World Health Capital Conference being held in Matsumoto is quite meaningful, and I would hope that the panelists can also make good contributions. So first of all, we are going to ask each of the panelists to take about 8 to 10 minutes each to introduce yourselves and give a bit of a presentation. And first we would like to ask Professor Mano.
Thank you very much, Dr. Komiyama, for kind introduction. I'd like to thank Matsumoto City Mayor Sugenoya for giving me such an opportunity. So the theme given to me is a city where health connecting people and communities. I work as a teacher, a university professor, but I was a doctor indeed and was treating people with dementia. And today I more or less study medical management, including medical care cost, health economics. So I'd like to speak from the macroscopic point of view. I am given just 8 or 10 minutes, so I have only 3 points to go through. I do not have time to go through detailed data, but Japanese medical care is really advanced. It used to be advanced. I do not know how it's going to be in the future, but it has been advanced in the world. I do not know whether it continues to be advanced in the future. I'm not really sure. That means there are some issues we need to face in medical care. And that is the second topic. And the third one is a new perspective which is required on medical care in Japan. Under the time limitation, I cannot be so full in my presentation, but I'd like to just go through some salient points. First, about this book. This is a book I wrote. And this is a book for general readers, in a sense. This is an easy-to-read book about Japanese healthcare. I wrote this book because of the following reason. And this is one of the good bestsellers. In this book, I compare Japanese medical care or German medical care. And this book is entitled Japanese Medical Care is the number one in the world. But unfortunately, my book didn't become a bestseller. But I wrote this book on comparing Japan and other countries in medical care. And there are some good points about Japanese healthcare. But the Japanese citizens are quite demanding. And it might be misleading, but Japanese individuals have less trust in medical care providers. And actually, this publishing company has been quite tough on medical care providers, criticizing them in their newspapers. Yes, of course, medical care providers are more knowledgeable about health than citizens, individuals. So I thought that I shouldn't be too critical of Japanese healthcare providers, and by objectively speaking, I think that the Japanese medical care is of high quality, and there are some data suggesting this. For instance, cancer survival rate is high in Japan, and this is showing how medical care in Japan is excellent, and there is indeed a public corporation naming itself Advanced Medical Care in Japan Foundation. I will not go through in details, but for instance, this particular quotation says that Japan has a universal healthcare insurance system. It is easy to get access to high-quality healthcare no matter where you live, and a high level of mother and child care, indicated by a low infant mortality rate. And from Canada, a think tank called Conference Board gathered this data, and Canada is highlighted with a certain gray color. But for Japan is given grade A evaluation for many of the items. Canada doesn't have many A's. What about the Netherlands? I don't see many grade A given to Netherlands. Sorry for this, but this is not my data. In my book, I didn't make country-to-country comparison. I rather made comparison between Japan and advanced countries at large. And Japan was faring quite well. And not only my own evaluation, but such a think tank also gives a good evaluation to Japan. But there are some concerns. Japan is a grade D for this. This is a self-reported health status. How individuals see and consider their health conditions. For this particular item, Japan is ranked D. For other areas, Japan is quite good in rating, but there are so many Japanese people who do not consider themselves healthy. Japanese people don't place a lot of trust in medical care providers, maybe reflecting that. Among others, Japanese people don't have a sense of health about themselves. And this is the data from OECD. For Japan, ranking very high, this shows a 5-year survival rate for colorectal cancer. The data is a bit old, but Japan is #1 in the world. As I showed you earlier, Japanese data for lung cancer or cancers in general or cardiovascular disease or stroke survival rate is quite high, or rather mortality rate from those diseases is low for Japan. But there are challenges we are faced with. There are some, but let me pick up some important ones. One is about Japanese society aging. We have many students in the audience, so let me go through this very quickly. The Japanese population is now shrinking, especially working age population is declining, and younger population, children, are getting smaller and smaller in population. And the Japanese healthcare system, such as universal healthcare, is one of the beauties we have, but can we sustain such a universal healthcare system, insurance system? And this shows the population changes in 2025. The second one from the right, this is a very important year. The baby boomer generations, which is about 2.5 million, a big block in the whole population, but those people become over 75 years old in 2025, increasing the financial burden on healthcare and the social security system. And those elderly people have to be supported by younger generation. One elderly supported by such a small number of working age people. Is that possible? As Dr. Komiyama mentioned, the longevity is a very good development, but it also gives a big burden on society. How can it be resolved? And this is another book, somewhat difficult to read. I wrote. This is quite cheap as a book, so please buy one and read. Then, solutions to such issues. One is innovation. A cliche today, however, innovation is a key. And the local authorities and local communities are very important in bringing about innovations. Innovations can be generated from various local areas, as was mentioned, the World Health Capital Conference. And we have invited speakers from relatively small European countries. Germany is a big country, but Germany is where the decentralization is very advanced, and the local authorities have a big authority in Germany, for instance. It's really hard to think the situation where 120 million people all oriented toward the same goal. That means we need to work on a smaller scale, not a national scale, on a smaller scale, even with the help of ICT. It is now age of local communities and regions. As Dr. Kondo said yesterday, local areas might be rated for health ranking in the future. So prefectures or provinces have to really take the lead. And the Freiburg city, I didn't know the connection between Matsumoto City and Freiburg, but it just happened that I had a chance to make a technical visit, and I would like to now turn attention to Freiburg. Well, I have been an economist. I might speak of a big picture. This morning we listened to an example of Usugi City medical care connected with the ICT. And Matsumoto City, I also hear that is trying to introduce such initiative. And Germany is ahead of us in that regard. And I take an example of Freiburg because Freiburg as a city is promoting the notion of a health promotion city. And I visited Freiburg for that reason. Freiburg has been known for a city of a good environment, but as Dr. Kondo mentioned yesterday, environment and health are interrelated with each other. And Freiburg is now promoting itself as a city of health promotion, and they consider water a very important old architectural landmark building, and this is how the town looks. Due to time limitation, I cannot go any further, but there are 5 important points about Freiburg. Freiburg is a relatively small city in Germany. However, early on, it touted itself as a city of good environment and has taken initiative, and it's now quite known as a city of good environment. And I think many Japanese experts visited Freiburg for their environmental policies, and now it is working upon health promotion. In that sense, the Freiburg authority is being quite strategic. And Matsumoto City, including Mayor Suge Enoya, I think visited Freiburg, and they invited people from Freiburg to learn from them. Then how does Freiburg market itself, promote itself to develop the city? What kind of marketing strategies do you have? First, their strengths. They have a beautiful old town, and they have a long-standing culture. And the second is that they can have activities in the nature. They have the Black Forest, and they can enjoy a forest environment, and that is good for health promotion or prevention of illnesses. And also, as a city, it has been promoting health promotion. It has a university, so it has good medical studies, and they are strong on prevention of illnesses, and they are also competing with the Baden-Baden as a city of hot spring. And also, Freiburg has been promoting itself as a city of mice, meeting international convention and exhibition. So they bring people into the city to look for the tourist and visitor revenues. And number 5 is about health. Health tourism or medical tourism. From those point of view, Freiburg has some similarities with Switzerland, the French system. In Switzerland, their health cost is high. France has a different healthcare system, but they have a lot of visitors as medical tourism or health tourism. So, what I think of a city is that medical tourism or wellness tourism could be promoted by Matsumoto City, for instance, as a strategy in the future, as I learned from the city of Freiburg. And secondly, how can health promotion be implemented? I think there are many things to learn from what we heard from Dr. Kondo. For instance, the city can work with industries to promote health promotion as a new businesses. So such an economics point of view or a business point of view can be incorporated with the idea of health promotion. So those are the perspectives I wanted to share with you from the business management, economics point of view. Thank you very much. Thank you very much, Professor. So Japan is faring quite well in terms of the medical care, and local communities and local authorities and important and cities of small scale are doing rather well, including the city of Freiburg. And some small European countries are also a good example, including the Netherlands. And in the case of Freiburg, nice old town and the beautiful nature, and that exactly the feature of Matsumoto City, old castle and a very nice natural surrounding. And from marketing and business point of view, mice industry could also be a possibility for Matsumoto. Thank you very much for many suggestions.
Next, Mr. Kiyohara, please. Thank you for the introduction. But until last year at Kyushu University, I was working, and in Fukuoka Prefecture, I did epidemiological research in Hisayama town to look at lifestyle-related diseases. And right now I work at the Health Check Center and also the public organization created by the town, and which is Research Institute for Lifestyle-Related Diseases. Sorry, do you know Hisayama town, the young people back there in the audience? There are people who know Hisayama in the front rows, but from more than 50 years ago, the whole town started this research, and the Kyushu University Medical Department supports the research. And there are statistical, epidemiological data, and it is said that it's the most trusted data in the world. Hisayama has this continuous research done, and he was professor at that university. I'm sure it's difficult to say this yourself, so I said it for you. So, including the position of this town, I would like to speak about this town. We work on health promotion and also town development together with Kyushu University too. Hisayama town is in the east of Fukuoka city, and we started this research in 1961. In the past 50 years, population increased 1.3 times. 1.4 is for nationwide, so it's the average of Japan. But in Fukuoka city, or around Fukuoka, it was 2.2 times the increase. So the area where population increased the most in Kyushu. So why did Hisayama achieve the average of Japan in the 10th year, 1970? 97% of the town was designated for non-residential, so they did not become a bed town of Fukuoka City. So they wanted to protect their hometown by denying the development which started in Fukuoka. So why was this target for this research? The population and occupation breakdown was very average of Japan. So in this very average area, we had research about strokes and other diseases. If we did actual research, empirical research, we thought we could reflect that on whole of Japan. So right now, the age and occupation breakdown is still the average of the Japan's. For 50 years, it has maintained that position. So in this town, we have the university, a town hall, general practitioners who all collaborate to work on the health of the townspeople, to look at what kind of diseases they have, they work on the treatment, and they work together to maintain health. university does not touch on the treatment at all, and if the GPs find it too difficult, the university hospitals back up for treatment. So this is how the roles were broken down. In this way, we got many information about the health checks, the mortalities, etc. So this is called the Hisayama Town Research, and the town itself will work on the health promotion of its people. So university, general practitioners, the town, municipal government, town hall, in other words, worked on this. And after someone passes away, we do the autopsies, and we looked at very different types of information reflected on health promotion, health management of the people. For the town hall, it worked on the health of the area, the society, and the people. And in order for people to be happy, of course, health comes first. But it's not just health of the person, the area they live in has to be healthy or sound. Society has to be healthy for people to be happy. So that is the policy in the town development. In the Hisayama research in 1961, we looked at people of over 40 years old doing health checks and tracked this group throughout the 50 years. At first, it was empirical study for strokes, but there are people who will have strokes and not have strokes. So we went back to the health checks to see what kind of health state did people have and had possibility of stroke, and tried to find the factor for the cause of strokes. And so we do it now in 5 years to track this group and compared the data to see how lifestyle diseases and of Japanese people had changed, what were the health problems of that age. So we looked at the consultation rate of the groups is very high, and the autopsy rate is very high too. 75% of the people who passed away was sent to the university to do autopsy to find the cause of death and hidden causes of death, whether the person actually had a brain stroke, what was the cause. And we also look at dementia today. So in the past, there were subjects of over 10,000 people, and the track rate was 99%. There was only 3 people who was not tracked. So we will continue with this track study. I'm sure you all know very well, but starting with brain strokes, these cardiovascular diseases have risk factors, which was mentioned in the lecture before: hypertension, diabetes, hypolipemia, obesity, smoking, drinking. This is a known fact among the Japanese. So they are risk factors. And Hisayama research started to take this up first, which had spread to the whole of Japan now. When we started this study, we didn't understand the mechanism of stroke. Someone said it was a genetic. And even if we said it's hypertension, there were many scholars who said it was not the cause. In Japan in the 1970s, the mortality from stroke decreased in the 90s. From the 50s to the 70s, the mortality rate from strokes was highest in Japan among the world. But in the 70s started to decrease. In the 90s, it was the same about the United States and European advanced countries, and Japan became one of the highest longevity rate country. So we contributed to the resolution of stroke deaths. The epidemiology of Hisayama Town has very high quality data, and the higher the quality, the higher the frequency of the disease. So in Hisayama, you get high frequency of disease rate, and we receive a lot of criticism from that. because maybe you are not doing good health management there. The only comparison we can do with is mortality rate, because in the other regions, mortality rate is followed very closely. And the causes are found, most of it is the cerebral infarction, cerebral hemorrhages, and cerebral and cardiovascular diseases. These are the three main. But if you look at the mortality statistics of Hisayama and Japan, and now first of all, if you look at brain strokes, if you look at from 60s to 2000 in Hisayama, in comparison to Japan, and for people over 40 years old, even back then and today, it's the same age breakdown. We did a study statistically. So in the 60s, we started this. But already Hisayama had minus 19 from the average of Japan. So in the 70s, it was minus 60, and it's been decreasing throughout. Right now, it's minus 36% to Japan. So similarly, if you look at cardiac diseases, it's now minus 50%. And cancer, at first, in the 60s, Hisayama's cancer deaths was plus 17% to the nation, but right now it's minus 18% to Japan. So what causes the deaths of the Hisayama people? If you look at the other causes, it's still lower. It's minus 19%. So the Hisayama people were comparable to the average Japanese, but today we are super Japanese, and for ahead of 20 years, we were able to decrease the mortality rate. And what was good? We only did one thing: we tried to prevent strokes. So preventing a brain stroke is to find the risk factor, for example, manage hypertension, work on lower obesity rates, and not smoke. And as we worked on these factors, it all led to prevention of a disease. So what we learned here is that preventing one disease is good for all diseases. And we have so many different information today. You have health programs on TV, so if soybean powder is good, everybody goes for that. So much information. Everybody has overflow of information. But rather than going after all that information, we should focus on one thing, prevent one disease, which is actually easy to communicate to the townspeople. And as a result, a lot of the townspeople became healthier. So all is good. Should we end this research? No, we have a different health issue. The most serious issue today is dementia in Japan. From 1985, we looked at people over 65 years old to do the elderly research. And there looked at frequency, dementia, and factors that led to dementia. And we had 5 screening studies, and the consultation rate is over 90%. So after 1985, probably we know most of the people who had dementia after that year. And if you look at the frequency, it looks like this. At first, if you look at 65 or over, it was about 5 to 6%. Now, among the elderly in the town, about 18% have dementia, which means that if out of 5 or 6 people, 1 person has dementia. And in the region, you have more dementia patients than cancer. So if you apply this to the whole of Japan at the point of 2012, out of the 5.5 dementia elderly patients, well, that is the number of dementia patients we have in Japan. MHLW's official number was 4.62 million. And the difference is because of the accuracy of the research report. But this is the biggest issue. And the more serious issue is that because we have an aging society, when we calculate in the 20 years, so 2035, If you leave it like this, there will be 10 million people who has dementia, and at that time, the total population in Japan would be 100 million. So in 20 years, 1 out of 10 people in Japan would have dementia, and can the Japanese government bear that burden financially? So our system, insurance system, will disintegrate. And we are now working on the treatment of dementia around the world. Until the first half of this year, there were 22 drug developments, trials, but all failed. So we don't know when we will have a cure for dementia. Even if we have, what happens when we use it for 10 million people? That would break out the medical cost budget. So which means we can only work on prevention. So at Hisayama, we look at the risk factor of dementia. What's the cause? There are genetic factors, especially Alzheimer's, more than environmental factor. So there are environmental factors too, like hypertension, diabetes, smoking, especially from mid-age. Especially diabetes leads to Alzheimer's. And for protective factor, it's the diet centered around Japanese food and milk and vegetables. So if you have this kind of diet, the risk goes down to half for dementia, and also regular exercising would decrease the risk. So dementia is caused from genetic and environmental factors. So it can say that dementia is also lifestyle related, and if it's lifestyle related, prevention is possible. So at Hisayama, we're trying to find out how to prevent dementia. So this is one example. That was about people, but we also look at the healthiness of the town. The next town has a population of 1.5 million, which is a big city. And so we try to utilize that to try to block us out of that, not to include more population or not to increase the population. And we created street gutters around the town to create a block. And the town is always trying to protect nature, so we try to purify the waters and the gutters so that even fireflies can grow. So you can see the firefly dance in the town in summer, and we also have enjoyment of rivers and Hisayama town. We are very close to nature, so we work and play in Fukuoka, but I have very good living in Hisayama. So Hisayama is like the Beverly Hills of Japan. And protecting society also means we have to protect tradition and also try to have consistency, unity among the people. So we have these festivals and traditions. We protect tradition, have a connection between the people, to protect the region as a result, and also in the end protect health. Thank you. Thank you very much. It was very impressive, and it's all due to your very long period of work in the research study. And dementia is a challenge for anywhere in the world, and prevention is important. And is that what you're saying? We understand that from your lecture very much. So next speaker.
I'd like to call on Dr. Yuma. I am from the Institute for International Socio-Economic Studies, and my name is Yuma. Thank you very much for giving me this opportunity to talk today. And, well, we are doing the policy research of the NEC group, and I myself have the theme of aging and ICT. Along with aging, there are various social challenges which occur. And so what kind of role can ICT play? That is what I am mainly researching. Today, well, I am on the ICT side, so I would like to talk about the health platform, health and healthcare and elderly care. can this be handled in one platform? That will become increasingly important. So I'd like to talk a little bit about the policy there. And needless to say here, the speed of aging and decreased fertility in Japan is accelerating. And I think that is something that you all feel very much. And as Professor Mano mentioned, it's not just increased numbers of elderly, it means also that the working population will be decreasing. And along with that, the social security expenses are increasing, the deficit is continuing, and the percentage of the social security is very high. Compared to 1990, it's almost double. So we have to do something about this, and that is what the government as a whole is trying to tackle. Abe administration is doing a lot. That is, for example, the tax reforms, also the regional health care and elderly care is what he's emphasizing. And of course, ICT is one means or one tool for resolving the issue. And in particular, there is the Growth Strategy 2017, which was announced by the Abe administration in June this year. And there are strategic fields for Japan to continue to grow. Which areas should we invest in is recommended. And the extension of a healthy long span and how ICT can be utilized is written in detail in this report. So what is Japan doing right now? As was mentioned, on the government administration level, a direction is indicated. And that being the case, when we talk about the health, it is mainly promoted by the Ministry of Health. And there is a council which started in 2015 to consider this, and recommendation has come out. In the morning, we heard the Usuki City presentation, and that is one guideline for promoting ICT, and there are 3 infrastructures that need to be established. One is the next generation type of health management system, that is various data related to healthcare and elderly care will be gathered and analyzed so that it can be linked to the optimal care. Second, this is a temporary name, People, and that was like Netherlands yesterday. Patients and people are going to be able to control their own medical data. And third is, we shouldn't just collect data and leave it alone. It should be made anonymous so that it can be used for research as well as policy making. So there are 3 major infrastructures involved. In the Netherlands, by 2020, things will be realized, but in Japan, we will have implementation in stages. And this is my personal view, that with regards to healthcare and elderly care, Ministry of Economy, Trade and Industry and Ministry of Internal Affairs has been very proactive. But the Ministry of Health has been a bit more cautious. However, I think now maybe the trend is changing. And here you see these 3 levels. And on the other hand, what is happening overseas, this is very brief, but I'd like to introduce some examples. Overseas, in thinking of the health platform, there are cases where the government plays the central role, and then the second case is where the private sector plays the central role, and the third case is like the Netherlands, where both government and the private sector work together. And I think that these are the 3 main types. One is Denmark, led by the government. The size of the population is small. However, from quite early on in 1977, they have the accumulation of, this is paper data. It was made digital. And from 2005, the healthcare professional and the citizens both can realize access to the platform, and that is being employed. And from 2008, patient can access himself the medical records of his own. And this is the case where the government took the lead. On the other hand, in the case of the United States, you have probably heard of Obamacare, and U.S. does not have the universal kind of insurance system. And so President Obama introduced Obamacare, but before that they had private insurance companies that were playing a big role to provide health, and there is Kaiser Permanente, which is a big provider of insurance, and these insurance companies on their own provide services. They have companies that provide services, and the insured can only go to those hospitals. So the insurance companies provide as a service to the insured PHR, where the patient can view his own data. In the case of Kaiser Permanente, it is called My Health Manager, and already there are 4 million users. Well, Denmark has a population of 6 million, and one American insurance company has 4 million users, so you can understand the difference of the scale. And then there is Apple, famous for iPhone. These private companies, as part of their service, they have a device called Fitbit that you put on your wrist, and data is accumulated in your smartphone, and you can control it yourself. Finally is the case of the Netherlands, and they have both the government and also the private sector, and they are maintaining a good balance to promote this. The population is 70 million, and I think it is large after Germany and France, and then hospitals are being privatized, although non-profit, and so the Dutch health platform, and Erwin and Margot gave us presentations yesterday. The characteristic is that the government indicates a big policy, for example, to make sure that the digital data can be accessed by people, or there could be exchange between companies, and it should be a mutual use, and the rest can be left up to the private sector companies. Another key point is that how you involve the private sector. Yesterday, too, we saw graphs about the effect of investment, and for private companies, whether it is viable as a business is very important, and so that's important. And also, how can you get the smaller and medium enterprises who may not have funds but have ideas in the picture? Now, to summarize then, how should we go forward in Japan? So as I have just said, ICT in healthcare has 3 levels. One is in one institution like a hospital to have electronic charts and to use ICT there. That would be known as electronic health record, or EHR. And then between the institutions, you want to have electronic exchange of information. So we have HIE here, Healthcare Information Exchange, something like that. And then furthermore, with the accumulated data, the patients and citizens can view the data to use it for health management. That would be the personal health record. I think there are 3 stages in this way. How should we promote this in Japan? Already, we have a lot of healthcare-related people in Japan. We have national hospitals and prefectural hospitals and social welfare institutions, hospitals and medical association hospitals, and also private company hospitals. So that means that when we try to do something, it is very difficult to get consensus. And also, as we heard, there are some places that are advanced, like the presentation in the morning of the Sekibutsu network. And then there are those that are still paper-based. In other words, the starting point is quite varied. So if you think about that, first the national government has to provide a big framework, and then you add the regional characteristics to that. And furthermore, when we think about prevention, where the data is it with the schools or government or corporation? We need to connect to the health checkup data in all these places, and Fitbit and iPhone data that is held by individuals. In other words, how can citizens participate in their own self-care will be very important. And the data that is accumulated, well, it's meaningless just to accumulate it. You have to think about why you are accumulating data and indicate that to the people. Otherwise, I think it will be difficult to go forward. In other words, we say EBM or evidence-based medicine. And so in order to promote that, we need data. And also in the field of elderly long-term care, we want to introduce science to make it scientific. And also in the government, right now we talk about evidence-based policy making. Based on evidence, we should decide on policies. So these platforms will be useful for when we consider these trends. Thank you very much. Thank you very much. And that was discussion on how ICT can be deployed, and a very broad perspective. I thought, well, up to a few million population countries, smaller countries in Europe, the national government can take the leadership and bring things forward. And however, if it's on the order of the Netherlands, where the population is bigger, then it gets a bit more difficult. And that means that the government has to indicate the broad structure, and then various stakeholders, including the private sector, could promote parts of it. So what about Japan? Well, I think a very good suggestion was made. And when we think about World Health Capital, well, we say world, but we are mostly focused on Japan, what to do in Japan. And so I think that was very helpful. Thank you very much.
Now, next speaker is Mr. Saito. And Mr. Amano discussed health from the business point of view also. And your company, Aeon Company Limited, a big retail company, is quite at the forefront of tackling with the health and welfare, wellness. Thank you very much. My name is Saito with Aeon Retail Company Limited. Thank you very much for your kind invitation. In September, in Matsumoto City, Aeon Mall Matsumoto opened the services, and on that occasion, Matsumoto City and the citizens and residents helped us quite a lot. And even after the opening, we received many visitors at the shopping mall. Thank you very much for your kind patronage. So from the retail business point of view, how can we contribute, and what kind of interest do we have about health and wellness? So I'd like to speak of a health and wellness initiative our company has been dedicating itself to. This shows a global operation, an overview of a business. Aeon Group has operations in 13 countries, including Japan and Asian countries. And we have over 600 shopping malls or shopping centers. And so-called shopping mall, we have in more than 200 locations in the world. And we receive per year 1 billion visitors to our stores and shopping mall, and they enjoy shopping in our retail stores and mall. This is a business philosophy for the whole Aeon Group of companies. Triangle. In the center, we place customers and people, peace, and community. At the tip of the triangle. For us, as today's discussion theme goes, how can we address the needs and interests of a community is an important issue. In other words, how can we contribute to the betterment of the local community is part of our business philosophy and practice. Now, in our relation with the community, social contribution, there are various activities we are already doing. For instance, for a shopping mall design friendly to all the visitors, for instance, accessibility of the building and the use of service helpers and also dementia supporters. Store managers and employees of the stores are given certificates as serving as dementia supporters. And as we are doing in Matsumoto City, tree planting is another area where we work as volunteers. We also raise funds and do volunteer activities. We have a yellow receipt campaign, and that is total purchases made on the 11th of every month come with yellow receipts. And when the shoppers drop those yellow receipts in a box in a store, the total amount of purchases made are contributed to volunteer groups. Now, Dr. Tono speak of issues in Japan, for instance, concern about the health and dissatisfaction with the local community, and also old-fashioned social structure. How retail business can contribute to solving these issues, especially how can we make a healthy mind and body? How can we contribute to the reactivation of local community as a business? And also, how can we be a part of changing social structure which meets the diverse needs of citizens? And we are working on the local ecosystem in collaboration with many other stakeholders. This is a group of stakeholders sharing the same goal: companies and businesses, citizens groups and financial institutions, local governments, or universities and research institutes. All of us are working together to make the community better as a local ecosystem team or coalition. There are 4 important pillars in this local ecosystem. One is digitalization, the use of ICT to realize a stress-free experience. Second one is, as the society ages, mobility is going to be a big issue or inconvenience. How can we resolve mobility challenges? And the third is how to activate community as a value. And number 4 is health and wellness. How can we create a community and mechanism for promoting physical and mental health and wellness? How can we do this together as a local ecosystem stakeholders? Using our shops or shopping mall, we are doing various health-related activities. For instance, our employees are also certified as a dietitian, and they provide seminars on nutrition and education. Nutrition education seminars sound like things for children, but we have begun to organize seminars for adults. Those who cook at home need to know more about nutrition and health, otherwise children wouldn't understand. So we have begun seminars for adults learning about nutrition and health. And also, in collaboration with the local group, we do a health exercise. Certain stores open at 7 o'clock in the morning, and the visitors there do an exercise to the sound of the music. And those visitors then eat in the restaurant or watch TV in a corner in a shopping center. Or we do the walking lessons or exercise-related seminars. And another initiative we are doing in our shopping mall is walking in a shopping mall. Matsumoto City, we do have a very big shopping mall, and shopping mall is all-weather accessible facility with good air conditioning. There are no strong wind inside. This is an environment where people can enjoy walking in a sense of safety and security. And this is a thing we are promoting among visitors. This is a place in Saitama Prefecture, and the person at the forefront is Mr. Duke Saraie, a well-known professional walking teacher. And so many visitors took part in this walking lesson. In 2016, walking and many other health initiatives were organized by AEON, and we issue health points for participants in these health activities, and that is done in various AEON stores around this country. And also in our shopping centers, we place health stations for self-measurements of blood pressure or bone strength. When we opened the Matsumoto shopping center, we understand that Suganoya mayor took part in this self-measurement experience. So we encourage visitors to check their status of health every day with devices, but also we are thinking of using self-measurement data for health management through the use of ICT, for instance. That's exactly what we want to do as we go forward, checking your own health status with those devices. And also we have a big data retail behaviors, their health status, and their exercise, like walking in a shopping mall, and also what they purchase. All of those can be gathered together and generate a new insight into their behaviors and their health conditions. In other words, we could utilize such big data and analyze for different purposes for health promotion. So in shopping mall, we make people enjoy not only shopping, but also we encourage more social participation through various experiences in a shopping mall. We hope that people come not only to shop, but also to enjoy different experiences. For instance, watching a film in a theater or entertainments. We would like to provide a space where people can enjoy a lot of experiences. We opened a big shopping mall in Matsumoto City, so I hope that many citizens will come to such a space as an area where they can enjoy a lot of activities in the community. Thank you very much. Thank you very much. From the 18th to 19th century, agriculture was the main industry in the world. In Edo era, Kaga, Kanazawa area had a lot of production rice, and the size of rice produced was a yardstick to measure the size of economy of that particular area. But today, rice was replaced by steel, and the steel industry became the main key industry, and then they were replaced by semiconductors. Silicon chips became the main industry in certain periods in history. So thus, the key is changing from upstream to downstream. I do not know whether these phrases upstream and downstream is right, but the main industries are moving toward the areas closer to end users, consumers. So retail business is now a very important industry. Medical care is also considered important, and the online shopping such as Amazon is another one which is driving the whole economy as an industry closer to end users. And it seems that that is the way for you to survive in the future. And this is one good thing about the liberal democracy and economy. And Mr. Saito spoke of the raison d'etre or retail businesses. Well, we listened to the 4 presentations, and all of us gave us a very well-balanced point of view. Professor Mano gave us a whole picture, and Dr. Kiyohara spoke of 50 years of experience. 75% of the people who died accept the autopsy, and I think this is one of the rare places where so many people accept the autopsy done on their bodies after their death. And Dr. Yuma spoke of the use of ICT. What and how are we going to use ICT in the healthcare? And Mr. Saito discussed consumer service industry, a retail industry, which is a main industry today, and how they are contributing to community and health. A very well balanced panel presentations.
So listening to the 4 panels, because their fields are so different, if you have any questions to each other or clarify anything that you heard from each other, it would be interesting for us. What do you think?
どうぞ先生。
Yes, please. I have to leave early, so I would like to ask at the beginning and also comment. I have 2 things. One is to Mr. Saito. Maybe it's more a comment. Right now, of course, social security is very important, but sustainability is a big challenge for us. And AEON is a private business. Of course, you have to have profit. So while gaining profit, if you can return that to society, especially towards health, and when it comes to prevention, we cannot cover everything with tax or social security. So it would be really great if AEON can work in that area. So it's more like a comment. And a question is that towards Hisayama research, and I discussed this separately also, but in the preventive area, since I am a doctor, you are also, if you look at the balance between treatment, it's not that Hisayama ignores treatment. Treatment is also very important, but I think what in Hisayama's case is prevention, the higher percentage which gave the results than treatment. It's not just prevention. The GPs in the area have collaborated in the research very much. So with even hypertension, and with just changing lifestyle, it does not eliminate hypertension. Hisayama has a flat curve for hypertension. And salt intake is quite low. Still, hypertension still remains the same. So what do we do? It's only treatment that can work on this. So between prevention and treatment, there has to be a very, very close relationship. And the Kyushu University, it works on prevention. Town also works on prevention, but we cannot eliminate a risk factor. If we have higher risk factor, we quickly connect that to treatment. So it's a collaboration between medicine and prevention. Between Kyushu University, Town, and GP, we said we had a 3-party collaboration. So that has to work well. And so we bring the problems smoothly into treatment and medicine, and that's how health management was done very much. So medicine is very, very important, but we get epidemiological information about how it was treated also from the medicine side. Yes, related a little to that is that in 1985, the cohort for dementia started, so it's 32 years now. Oh. And you said that 10 million people with dementia cannot be supported in 2035. So you have to work on prevention. So do you have any clear idea how it's going to be done at Hisayama? We know dementia is caused by many different factors, but there are two clear types. So one is vascular, like Alzheimer's, so it's arteriosclerosis. Alzheimer has the waste protein material which creates a spot and destroys the neural system. And we thought that it was genetic at first. So if you reach a certain age, that person gains Alzheimer, we can't prevent. And we thought that the target was vascular dementia, so we tried to prevent that. However, at Hisayama, that did not increase. And Alzheimer, which we thought was genetic, is now increasing very much. And if you eliminate the influence from the elderlies, it's really increased. So the biggest factor or risk today is Alzheimer's. So cerebrovascular failure, is that correlated to intake of salt? And yes, about 50 to 60 years ago, yes, stroke was said to be genetic, but we found out it was related to lifestyle. And if you control the risk factor, we were able to decrease stroke rates very much. And now Alzheimer's, we know in Hisayama, is a lifestyle-related disease. We thought it was a genetic disease. So we have to work on the prevention. Now, sorry, I started rushing you. So the biggest factor that increased Alzheimer's is diabetes, increase of diabetes. And Hisayama did a research in detail in diabetes. So we have total screening check once in 5 years. And to all people over 40 years, we had the sugar load test. So we did very detailed test, and we tracked them. And from the little candidates of diabetes, we are trying to work on the prevention, and we think that in Hisayama, if we try to decrease diabetic patients, that would lead to decrease of Alzheimer's. And in the 2010s, diabetes, which was on the increase, was started to decline, which means Alzheimer's also decreased. Well, Alzheimer's is increased to 18% now, but we have to do research to find out if that is on the decrease. So we sort of advanced the elderly's research 2 years to try to see if it had affected Alzheimer's. So any other question? To Dr. Kiyohara and Mr. Saito. So in order to change something, one is incentive required, and another is sense of crisis. And we might need both, but at Hisayama, you started this large-scale cohort, and Aeon, you started new initiatives. So which side really pushed you to make that change? So who's going to answer first? Dr. Kiyohara or whoever? Well, on Aeon's side, we had started new initiatives from Sense of Crisis. We talked about the population breakdown to see what kind of residents there are. There are less people. We have more elderlies. The fact that we have more elderlies means that the diet volume becomes smaller because the stomach is going to be weaker rather than stronger, and which means that there will be less shopping. So we tried to create a foundation in the region. We wanted to be a retail industry that is loved by the people. So that's why we started this initiative little by little. Thank you, Dr. Kiwara. When I was introduced, we have been working on the Hisam research for 36 years. Again, it's sense of crisis because we wanted to find out what brain stroke was. In the 60s, brain stroke started from the 30s, and people started to die, especially when the children were small. You were in the prime time of working. And we had sense of crisis because if you can't protect those people, the family would disintegrate. And if you have diabetes, it could lead to brain stroke. Now it's leading to cancer and to dementia. So we had to convince the people that they had to start this study. So the townspeople and the health experts are starting to become tired now. And from about last year, there is a successor, Dr. Ninomiya, after myself, but he is young. He has young ideas, and he is very active. So he is now working together with the IT industry. Yes, I was going to just ask about that. Should I continue? So Dr. Kiyohara is still very analog, yes, we were, but from here on, we're going to be more digitized and incorporate IT know-how to control health, which means that the health check data can be enabled to be seen on your smartphone. Also, risk scoring is something that we work on. Health check data, if you fill it in, maybe you can see the rate of getting diabetes in 10 years, or what is the risk rate compared to people in the same age, or the risk of brain stroke. From tracking studies, we create these statistics. So, for example, if you smoke and if you stop smoking, your future risk might be half. If we can create that kind of calculations and statistics, well, actually, the health expert does that right now. But if we incorporate that into IT technology so that the townspeople can manage their health themselves, and we can give points to them so that if someone improves how much, they can get how many points. And we are still thinking of what incentive should be given. Oh, you can bring Aeon into that incentive. So maybe you can buy something, maybe you can buy health goods. So we'll do something like that so that people can enjoy managing health when we are trying to come up with a system like that. So I have two questions right now. One is that whether you can work together with Aeon, and also to Mano-san and Yuma-san. Ms. Yuma talked about how to incorporate ICT in Japan in the health area, but Dr. Kiyohara is trying to start something, which means there will be another new system created. And before the government rules and legislations established, what are you going to do? Are you going to ask him to wait to create a system? Well, that's a very difficult question for me to answer. It's a question. Yes, like you said, already today there are so many different regional networks in different regions existing. And I'm not saying that I'm crashing everything to create one big system. That is not what I'm saying that is good. Because regions have their own characteristics. The municipalities have their, some have their own networks. Some are centered around universities, some around hospitals, some around nurses. So the support in the region are different according to that area. So it's fine for any region to develop their own systems, but to be able to collaborate with the neighbor network, you have to set rules, and when that rule is established, you have to think of how to exchange data based on those rules. then the government is the one who decides for the rules, and that's how I think it should be done. You don't have to wait, and if the government is slow, you should push them, but still work on your system development. What do you think, Dr. Mano? Well, I exactly have the same opinion as you. I also think that ICT policy is a specialty of Ms. Yuma, so I don't know very much, but medical tourism, globalization of medicine, I know a little bit about because I talk with people at METI. And in this age today, so many ministries are involved in vertical solutions, and it's okay for them to work on that. But especially if you are a private company, monopoly is not good. You have to have competition. But when it comes to administration, authorization, authentication becomes involved, and it's very, very complicated. So rather than me talking about this, you might be able to speak about this more, but the whole government itself is struggling right now, and maybe in that environment, the regions have to work on their own in terms of the digitization. I feel a little bit, but what do you mean by that? Well, I was going to explain. Specifically, of course, it should be guided by the government, but like in the Netherlands, the region developing will depend on the funding because they are not as rich as the central government. They have to gain revenue as they do the development, and also like they can work together with private companies like Aeon.
So that could be one method, and the government, it could be that, and we discussed this before, could make investment if it's going to be profitable. Make something like a CC, yes. And ultimately, there can be revenue for the government, but it's the government, so it can't really be profit. It has to be recycled back to the people. So there has to be an ecosystem where money will be circulated. Yes, I think that's a very good idea. Well, it's true that Japan has had rather unorganized direction, and I think that if we wait for the government, then in 20 years' time, there'll be 10 million people with dementia. 20 years can pass quite quickly. So that means that the regions have to work and work hard. And in Hisayama, we are doing detailed research. And it's not just for the people of Hisayama, but for the people of Japan as a whole. And ultimately, it has to be a method that is simple enough that every municipality in Japan can emulate. And for example, risk score model. For example, a risk score to estimate chances of having dementia. And if you put in data, then what would be, say, probability increasing of having dementia or Alzheimer's. So it should not be some special test just for Hisayama. It should be getting the same results even if you use data from other regions. So that means that other regions can make use of our system. And so long as you have the software incorporated, then it will be able to run. In one region, there should be an experience which can be also capitalized on and utilized in other regions. Mr. Saito, and then Ms. Yuma once again. What Mr. Kirihara said about the risk score, actually, we are thinking about the same thing. And if possible, we would want to team up with them. And our focus, well, we have efforts in various places and also in Fukuoka, in Kyushu. And so well, we don't have an AEON store in Hisayama, so maybe we could have a tie-up in a store in Fukuoka. And so maybe that our retail store in Fukuoka can be used. And as Professor Mano also mentioned, this effort is not a social contribution activity. In other words, this is also an economic activity, and we have to add that economic activity. We're not saying we have to make huge profits, but it has to be economically viable. Otherwise, it's not going to be sustainable. So, one aspect in health, our customers, well, most of our customers are healthy, so health for our customers ultimately should be linked to our own profit, and we would want to have a structure like that. Naturally, we cannot do it alone. We need universities and ICT advanced people and government people, and we would want to work together, and we hope that will be spreading all over the country, so that everyone all over the country can be healthy. Thank you very much. Yes, Ms. Yuma. It's not that the government doesn't have to do anything. Rather, eventually, maybe we will each have a card, and you could go to Europe perhaps. If you get sick overseas, you could be killed, so you might need the card to be used overseas too. So what should we... Well, there has to be certain decision taken, and then the rest can be left up to the private sector. We heard a wonderful lecture from the Ushiki Hospital this morning, and I would want to get your opinion too. Yes, there are things that the government has to do: data standardization, interoperability guidelines. What do you mean by data standardization? Are you saying always getting a blood pressure measurement in the morning? What do you mean by standardization? Well, blood pressure data will be put in electronic records, but in a certain hospital, you take the top data and the bottom data. Some hospitals will treat them separately, and other hospitals will take 70-200, and they will handle it as one data. And sometimes it could be consecutive data. So even if it's one blood pressure, a system is only zeros and ones. So if you have hyphenated data and you have single data, well, should the government decide that? Yes, it does. And the other thing is, as was mentioned by you, there is also the cross-boundary aspects. In Europe right now, there is the trans-boundary kinds of work. Guidelines for the interoperability can be determined. For example, a Dutch person can be treated in another European country. And I was hearing from Erwin about this yesterday. Similarly, in Japan, each region is like a country too. So I think that we need to also think in this way, more transboundary. And the data that will be required, well, for example, maybe the data does not lie with the healthcare facilities, but it's AEON who has the data. So we have to have the standardization and interoperability decided clearly. And for the organizations that's going to take action, this is going to be very important. Matsumoto's rival, Usuki City, a doctor from Usuki City. Yes, I had a presentation in the morning. I'm from Usuki, and well, I didn't think about going overseas, but in Japan, as Ms. Yuma mentioned, yes, for sharing data all over Japan, we do need a standardized format. For example, in the world of healthcare, we have something called SSMix2 from electronic charts to get data. and then you go to the cloud, and that language will be applicable in healthcare fields, perhaps. But if you want to combine with other fields of data, maybe it's not going to go well. For example, 2035, if you read the report about that, there's EON data and other data which need to be combined and used together in the future. And that being the case, how are you going to have a format or a form where you can where everyone can use the data? Unless the government will provide an indication of that, we cannot go forward. Well, it might not be just one national government indicating a standard. It could be perhaps a global organization. But in order to gather data and use it, are you going to use the My Number, or are you going to have some system where you have a database and there will be an automatic linking of names and data? There has to be some kind of structure for this linkage of data, and that has to be determined by the government, or otherwise I don't think we can go forward. I see it's very difficult because we have a population of over 100 million and so many vertical structures and silos. So I'm wondering if we should have too much expectation towards the central government. That may slow us down. So, as Professor Mano said, we have to think about it's now the age of the regions taking initiative, because Kyushu has a population of what? I think Kyushu has a bigger population than the Netherlands, maybe? So it is going to be very difficult with such a big population. And Professor Kihara says if you don't have a system yet, then maybe the Usuki system can be utilized. What do you think? Well, we try to stay out of this kind of health care. That is, we are not going to intervene in the GPs. We don't want to disturb their marketing, and that is why we are able to get the support of the medical association. Now, to the residents, we say we can give second opinions after consultation, but the healthcare will be, the central players of the healthcare will be the doctors. And so it's very difficult for us to intervene that far. I see that means there are lots of difficulties. And this is a weakness of Japan. There are strong regions, strong universities, yes, but when I was at the University of Tokyo, within University of Tokyo, they tried to introduce ICT, but the departments couldn't be connected. Well, what about other universities, we thought? University of Kyoto, same as us, or worse than us, actually. And they had so many internal systems, and so it's like each university all have their different systems, and maybe Ms. Yuma's institute is also involved here. So yes, maybe each party is strong, but as a whole we cannot link up. So on perhaps a regional scale, maybe it would be easier for a smaller scale region to take action, and maybe that is important. And well, amongst yourselves, yes, Mr. Kihara. PHR and EHR. That's mainly right now hospital data being connected and utilized, I think. But the occurrence of the disease is not from the medical level, but for example, you could take blood pressure. Hypertension is, say, 140 or higher for the higher part, and then 90 for the diastolic part. But if you look at how the residents get sick, strokes, could occur at the blood pressures of 120 or 80. Risks could start there. But 120 and 80, or a little bit higher, 130, even there, the risk is high. But those people, well, just because they say that they're at risk, they're not diagnosed as having hypertension, so they won't get drugs. So I think healthcare or medicine alone will not be able to save people. So that means that the health checkup data. Well, what about the people with blood pressures of 120, 130? Well, in that sense, the public health nurses, workers will be playing a big role, because actually checkup data is quite disparate, and more than hospital data, it is quite disorganized. So how can you have standardization there? There should be something uniform. Have you seen such moves to standardize? Well, earlier I introduced 3 platforms, and not just the medical or elderly care institutions, there was also the other parties, which would be inclusive of the private companies, and we want them to be able to use data too. But to be specific, I don't think that very concrete or detailed discussions are taking place as yet on the government side. Well, I want to introduce a new topic here. That is, the government, well, we don't have ample funds. And we have so much costs, and we have very few funds that we can dip into. But we have to have a structure where money will circulate. Otherwise, we will not be able to realize a city where health will link people and the community. Recently, we talk about social impact investment, method of investment, and from that perspective, to resolve social issues. So health will be one of the biggest issues. And I think that way of thinking is appearing, and there are so-called dormant savings account, which I hear is about 70 billion yen. So perhaps sleeping funds can be utilized. Kobe City tried to do an experiment where, well, right now we discuss diabetes many times over the course of the conference, that it could be leading to dementia. And to be specific, if you suppress diabetes with drugs, then it will be 200,000 or 300,000 yen. But if it's dialysis, it's going to be 5 or 6 million yen. And that means it's going to be a big problem for the government finances. So reducing diabetes numbers. In Hisayama, you were able to do that. And in order to reduce the number, you can spend some amount of money, invest, so that with that investment, for example, well, patients on dialysis could be decreased. It could be done by NPO or corporations, but if it's not going to make profit, then why would they do it? Health insurance, it will be instead be paid by health insurance. But if the number of dialysis patients are reduced, if the public sector could give some money, because they will be saving money anyway, if we could come up with such a system, and I think we're trying to test that kind of system out, and using the so-called dormant savings accounts that nobody is claiming. So I think that can lead to business, and how can we move funds around and make them more dynamic? I think I have to also be mindful of the times.
So yesterday, social impact bond was referred to by a gentleman with METI. That's one idea, as Dr. Kamiyama mentioned yourself. And another one, this is not only limited to Aeon Company Limited, but some companies are making a huge profit. It's not a Japanese company, but American company, Amazon or Google. they have a tremendous surplus revenues, profits. They have no way to spend their money, so they are investing like investment companies. Of course, we have to make a profit in core businesses. But companies with a huge profit can spend part of their excess reserves for social purpose investment. And also, as has been said in Japan, there are wealthy people, a wealthy class in Japan to some extent, and they could be drawn to Matsumoto City and invest in some way. And some might be the people who were born and raised in Matsumoto. So those are another sources of funding. Thank you very much. I agree. Anyone who would like to make a follow-up comments? Dr. Yuma, thank you. As has been said, it's a very important perspective, social impact. Thank you very much. As you might know, one coin is enough to have your diabetes blood glucose checked by CarePro Company Limited. So young people have begun a social business like a social impact bond. It's a small social contribution, and those small companies may be part of the healthcare solution providers. They would find a diabetes who are still a mild stage of diabetes, and then once they are found that they are having diabetics, then they would go to a hospital and see the doctor and receive the treatment, and such benefits are limited to the company or to the users of that company's services. But such social business companies could have a more impact that would reduce the medical spending, then that would have a bigger impact. So is it going to be an incentive or sense of crisis? The presidents would say that it would make a good business, well, he would say that it would be a matter of a bankruptcy. So some economic incentives, if that is created, I think more companies will be willing to invest in social causes. Mr. Saito. Well, we are not making that huge profit, I have to say, but as I mentioned at the outset, for us, how can we, the retail business, continue to survive in the local community is an important issue. And prevention has been mentioned on our part. In daily shopping behavior, is there anything that can be done to prevent chronic diseases? That's one thing we are trying to look at. And I earlier mentioned health stations where people can make self-measurements. And when we often tell our visitors, what do you think of this measurement? And the visitors often ask us, what does this data mean? And somebody mentioned the risk score. If they would know how the data relates to a risk, they might change their purchase behavior. We might be able to help to change their shopping behaviors. When we look at the trend in the world, companies are seeking not just to make profit, they will not be able to survive with that trend. ESG investment, environment, social causes and governance. ESG investment is essential for a company. And those are the companies to whom the individual and institutional investors would invest. And there are 30% of such investment given to such ESG-oriented companies. And that's how the society is changing in the world. So that's how and where the money goes in the future. So I hope that ION as a company will make profit in that manner. And I hope that Matsumoto City can consider that as a strategy. You might not believe this, but I am not rich at all, but in the world there are so many places and companies and parties who have redundant money. Do not know where to invest, and the central bank is taking the easy money policy with so little interest paid, but there is no way for making investment for such a surplus money. I'm telling this to young people. If you have a good business, if you have a good idea to start up a good business, then you will be able to get investors. And that's really different from 30 years ago. So idea is very important. If you have a viable idea for a viable business, then needless to say, you will be able to receive investment from potential investors. Perhaps I should ask two keynote speakers. Thank you very much for your keynote speeches yesterday. You have listened to the panel discussion or lectures. What is your impression? I may have some comments from you. Each one of you, please.
Thank you very much.
同時通訳入ってますから、
So the Japanese participants, please use an earphone.
Please go ahead.
Thank you, Mr. Komayama. Thank you for excellent presentations, excellent discussion. For me, it was very recognizable. In the Netherlands also, we see all these different roles, the industry, research, the towns, the municipalities, all playing a different part. And what I saw here is like connecting these two parts and seeing how that makes it work, because you have a common interest in getting real health for your people. So that I really liked about it. Maybe tell a little about the experience this morning. We went to a nursing home here in Matsumoto City, and that was also about health. The people there, they were stimulated to be actively in the daycare, and they got points, virtual money to exercise. And that is something that Aeon is also doing in their shopping malls, and it's also very apparent that when people are healthy, they have more income and they have more to spend. But that's not a bad thing, because you have a responsibility to society, and it's very good to combine that with the municipalities and the towns. It would be great to have the private and public partners work together. So Matsumoto City and a number of cities to join forces together and see which digital tools can help their civilians and which tools would be very good for diabetes or for dementia. Because there is a lot of studies about that. All you have to do is find the right tools and find the right platform to implement together. And if you have ample budgets, this is something you have to work out together. In the Netherlands, we have something the last 2 years we tried. It's called Health Deals, and our minister brings together a number of public and private partners, and they join for a common goal. For instance, there's a village in the Netherlands where assistive technology is used for the people to live independently, and they had a number of technical companies, private companies, the government, local government, and researchers join together and draw up an agreement for the next coming years, and say we're going to achieve this, and there's one party is going to pay, and another is going to deliver the knowledge, and another is going to take care of the implementation and take the professionals along. So it's all about cooperation together, and also getting the money from the right party to the right place. So I really liked it, and I think there are a lot of opportunities here for the municipalities to work together with research and private parties.
Thank you, Erin. Margot, could you speak some words.
Margos.
Thank you. Thank you for the presentations. They give a lot of insight, I think. I can agree totally with Erwin's words, so I'll just add, because some of the comments I wrote down as well.
Thank you.
But yeah, so what I really noticed from your presentations and from yesterday afternoon, there is a lot of insight from longitudinal studies for certain diseases, and I think that can be so useful in Japan, but also in other countries, in how to deal with these persistent diseases like COPD, the pulmonary disease, I think if I say it correctly, dementia and diabetes, etc. So if you use the information that you get from the longitudinal studies much more, I think, on an individual level, so that because you know, I've attended a lot of conferences, so I hear these numbers and I think, yeah, I've heard it before, but I think most people on an individual level, they don't hear it from their doctor, and the doctor knows their risk, but they don't hear it from their doctor. You know, so I think there could be more information toward individuals to help them be aware of their lifestyle, and then I think we can use IT. Yesterday we saw the robots to help with, IT, health IT and robotics to help with the lack of staff, maybe, or to keep staff healthier in healthcare. I think we should also use much more the IT to keep people healthier. So on both ways, we can use innovative methods to get a healthier community, healthier country, both for the workers as for the people that they're treating. So I think that would be my main comments on this.
Thanks a lot. 今ここにはたくさんね、女性の若い人が
We have
来て
many
いて、
young
本当に皆さんにはですね、
attendees in the
早
floor,
く社会に入って
and
ほしいと
I
思います。
really would like to
日本の弱
encourage
点
you
の
to
ね、
join
最大の
society.
ものはね、
One of the biggest weaknesses in Japanese society is as follows. When we have such a discussion, it's a male-dominated discussion.
年長者だけ
The
で
elderly
未
men
来の議
are
論をしている
monopolizing
って
the
いうのはほとん
discussion
どですね、
about the
日本から
future.
だけですよ。
And I think that Japan is, and also perhaps Korea, are the only two countries where such a discussion about the future is man-dominated. Women have to be represented at least half of the statements or discussion. It's not that I don't care about boys, but I speak to young ladies and women. I really would like you to take part in society positively and actively.
最後に一
And
言
now
ずつ
I'd like to turn to each panelist for the last comments. Mr. Saito,
今日
please.
どうもありがとうございます。
Thank you very
実は
much.
僕が会社に入ったのが一番最初
Well,
ここ松本
I joined this company, and the first place I was stationed in Matsushita, Matsumoto City. And in the past, there used to be Aeon retail store I worked, and I was there for 10 years. And in September this year, a new Aeon shopping mall was opened in Matsumoto City on a larger scale, and the World Health Capital Conference is held in Matsumoto City. So I would like to make some big contribution to Matsumoto City as a person who was raised in Matsumoto City when I was a young worker. And when many more people will join us, ideas could flourish. So I hope that Matsumoto City will come to me once again, so that I'll be able to return the obligations I owe to Matsumoto City.
ユーマさん
Thank you very much, Dr. Yuma. many issues were discussed. I myself has learned a lot. In Matsumoto City, MPHR, Matsumoto version PHR, is now being considered by the government. So Matsumoto City is taking the leader role for creating a new community with the use of PHR. I hope Matsumoto City is going to be spearheading the implementation of PHR. I hope that we'll be able to see that outcome in the near future. Thank you very much.
じゃあ清原さん最後ですけど。
So lastly, Dr. Kiyohara.
私も今日この会に参加させていただいて
Yes, I have learned a lot participating in this conference. In the epidemiological data from Hisayama,
共同研究やって
we have joint study with companies and receive funds from them. And we have the Research Institute receiving those funds.
やっぱりちゃんと
And what we feel is that proper data becomes profitable. And we use then that to invest into data, the research, maintenance of the research project. So the matter is how you create data which is usable. Hisayama is a small town, and the university is able to manage all the data. So for PHR and EHR, and by organizing those data, we are able to create a path for collaboration with private companies, and I hope this will be done. So I hope the Matsumoto City citizens will also do the same.
それじゃあですね、いつもですとここで私が10分ぐらい
And normally I take about 10 minutes to summarize, but Dr. Kihara just summarized everything today. Since we are now at time to close, I would like to close the session here. I thank all the panelists who have participated.